All right. Hi, I'm Anthony. I'm the student pharmacist who's going to be helping you out today. Can I start by getting your name and date of birth?
Hi, so my name is Riley. My date of birth is 10/10/1970.
All right. And what brings you in today, Riley?
Well, I recently had a small heart attack, and they put a stent in, which they said it might improve my heart failure a little too. But I've been having some shortness of breath when I do too much. My doctor told me that it's because of my heart, but I just wanted to get it checked out more with you.
Yeah, not a problem. Do you experience this shortness of breath just on when you're doing nothing, or is it caused by moving or exercise or anything like that?
Well, if I walk for 5 minutes or more, on a flat surface, or go upstairs, that's when I notice it. I don't have any symptoms when I'm just sitting down and resting.
All right, so I just want to make sure that some of the information we have you matches what I have here. So going over some other conditions that you have, other than the heart attack you had where they put in the stent, I also see here that you have hypertension. Is that right?
Yeah, I've had it for a while.
Okay. You have hypercholesteremia or high cholesterol. Is that right?
I think so.
Okay. And then I see here that it says that you have heart failure.
Yes.
Okay. And then is it all right if we just go over some of the medications that you're taking?
Yeah.
To make sure that it matches. So here I see that you're taking valsartan 320 milligrams daily. Is that right?
Yes.
I see atorvastatin 80 milligrams daily. Is that right?
Yes.
Carvedilol 25 milligrams twice a day.
Yes.
Furosemide 40 milligrams twice a day. And clopidogrel 75 milligrams daily.
Yes.
Okay. How often would you say you miss a dose, or would you say you're pretty good about taking them?
Well, I am pretty good about it.
Okay. That's good to hear. And what allergies do you have?
I don't have any allergies.
Okay. I see here that it says that you had a reaction to lisinopril in 2017. You experienced some angioedema. Does that sound right?
If you think so.
Okay. Well, we do have it documented there, and that will influence some of our choices later. So going forward, until I can reach out to whoever put that in your note, we'll say that you do have an allergy to the lisinopril. What other symptoms are you experiencing other than your shortness of breath?
Well, my water pill makes me pee a lot.
Okay.
And sometimes I can't even make it to the bathroom for taking it.
Okay. Yeah, it doesn't look like you're overloaded on any fluid right now, so we probably could reduce the dose on that and then just monitor your weight. Going back to your medications, what over-the-counter medications do you take?
I take a multivitamin and calcium with vitamin D every day in the morning. Sometimes I take Claritin for my allergies, but that's usually in the fall or spring.
All right. You don't take any aspirin over the counter, do you? Just those other two that you said, the multivitamin and the calcium?
Yeah, just those.
And then the Claritin in the fall and winter. Okay. What would you say your diet looks like?
I eat very well.
Oh.
I like to cook, and I usually have chicken or fish, vegetables, potatoes or rice. And I used to walk after my lunch, but it's been very cold the past few weeks.
Okay. In an average week, how much would you say you smoke?
I don't smoke.
That's very good to hear. In an average week, how much would you say you drink?
I don't drink.
Okay, that's also good to hear. Do you use any illicit drugs?
No.
Okay. What do you do for work?
I'm a secretary.
Okay.
you know, my water flows making me pee a ton,
Mm-hmm.
and I couldn't really make it to the bathroom, so I switched from taking it twice daily because I was waking up through all the night.
Okay.
But then I wasn't having any accidents.
Okay, so you had just been taking it once daily at that point?
Mm-hmm.
Okay. Like I said, it doesn't really seem like you're overloaded on any fluid right now. You haven't had any increases in weight recently, have you?
No.
Okay. No, like edema or swelling or anything in your legs like that?
No.
Okay. So yeah, I guess you could continue to take it once a day. You want to just make sure. Do you weigh yourself frequently?
I do.
Okay, that's very good to hear. You definitely want to weigh yourself every day, and let us or your primary care physician know if you experience any weight gain. We categorize it as anything from 5 pounds in a week or 2 to 3 pounds in a day. You definitely want to let us know if something like that ever happens, because we will have to increase the dose of your furosemide to hopefully try to get rid of some of that fluid. All right. Is there anything else you think I should know? Okay. Do you mind if I make a couple recommendations?
Of course.
Okay. So regarding your heart failure, essentially there's 4 pillars that you should be on. Right now it looks like you're on, you've got 2 of them covered. The 2 that you need are an SGLT2 inhibitor and a mineralocorticoid receptor agonist. Right now we're actually not going to add that second one because it looks like your potassium is kind of high, and that medication has the risk of increasing your potassium, so we're not going to add that one right now. We are going to add the SGLT2 inhibitor. It's called empagliflozin or Jardiance. It's going to be 10 milligrams daily. Some side effects are that can occur are you want to monitor for any UTI or any like pain upon urination, and definitely let us know if that happens.
Mm-hmm.
Regarding your heart attack with the stent that was put in, the recommendation is to have dual antiplatelet therapy. Currently, you're only on one. You're on your clopidogrel 75 milligrams. We're also going to put you on aspirin 81 milligrams or baby aspirin, and you're going to take that once daily. Another recommendation I have is regarding your shortness of breath. So a beta blocker is one of the 4 pillars of heart failure. The one that you're on isn't selective for just your heart, so it can affect your heart and your lungs and cause some bronchoconstriction. So what we're going to do is we're going to switch you to metoprolol succinate 200 milligrams daily, because it will only affect your heart and it won't have any effect on your lungs, and it should help with that shortness of breath that you're experiencing. Let me just go back through and make sure I'm not missing anything. All right. Yeah, I think those are all the recommendations I have for you right now. What questions do you have for me?
None.
Okay. Well, we can follow up in 2 to 4 weeks to check on your shortness of breath, make sure that there's no weight changes are happening. Yeah, if you have any questions, you can give us a call here at the pharmacy.
Okay, thank you very much.
Yep. Have a good one.